How's everything going, man? We're live. We're live. We're recording.
Sir, we're live. Just want to make sure I'm in the frame here. Nice. Yeah,
Yeah.
dude.
Yeah, you're good. So
Perfect.
you're just finishing up D1 year now.
Yeah, man. It's we finish up July 11th actually. So we have a few more finals left this week and next week and then one July. Yes, it's been pretty crazy. I don't think we've even talked since, I started my D1 year.
That's true. It's been a while. Yeah, wild year, right?
Yeah. So tomorrow we have an operative final. Our operative finals. It's like a number 3 mesocclusal slot prep. And then we just have a number 5. We're doing a MOD restoration. So we just have to fill that up.
MOD and then occlusal on number 5. Got it.
And then slot prep on number 3.
Okay.
Yeah. Yeah.
Okay. How long do you have to do that?
They gave us 4 hours. So it's like 1 to 5, essentially.
Good.
Yeah.
Good. Yeah. Do you have your technique down? You got to go a little extra time today?
Yeah, a little bit extra time today. And I think I was kind of reaching my limits. So I had to get out of there after a few hours, but feeling pretty good about it. But yeah, man, basically, D1, you're at Stony Brook. Obviously, you already know it's like really medical school based for that first year, right?
That's right.
So we went through all the anatomy, all the MFM, biochem, immunology, essentially, PhD, BMD, all that stuff. And then we went right into the dental school. Kind of got into, what was even our first class? It was like community we did. We did dental morphology, obviously.
Yep.
Waxing and stuff. And then you have, we do physio too. So we do cardio, CPR, essentially.
Yep. That's right.
And then we also do repro, endocrine, and gastro. So we did all that stuff. And then we also had, obviously operative class. So a lot of drilling.
Yep, that's right, operative.
Yeah, and man, just that's pretty much what life's been past like year, I guess. Just getting all this stuff through, and hopefully we're nearing the end of it. I know you just freaking finished, man. Congratulations.
Oh, thanks. Yeah, done. And congrats to you too. You got your white coat, so that's good to have on you.
Finally, man. I think last year it was in April, but now this year's a little bit later.
That's true. It was later this year.
Yeah, they moved. I don't know if I think it might have been for weather reasons or something, but they just had it, in May. That was cool, man. And it's just getting real now because now we're, once you start drilling, like, okay, well, now I gotta feel like a dentist.
Yep.
After all those years of med schools,
that's how it starts.
Yeah, dude. Yeah. So
good stuff.
Yeah,
you liking it so far?
Yeah, it's good. It's good. I'm still on a little bit of oral surgery track. Actually, I don't know if we even talked about it, but. So starting to study for the CBSE exam. And I went. So you took your first attempt at July of your D1 year, right?
Yeah, that's right. End of July D1 year. I tried to study for. I really just took it to get an idea. I tried studying for it. I was studying all the wrong things. I was doing like just Anki and first aid.
Yeah,
you really have to hit UWorld. You have to hit a whole bunch of things. But you haven't taken it yet though. So it's going to be, especially it's Stony Brook. It's different. Since you were in med school for the majority of D1 year, for you, this test is going to be similar. It's still going to be different, but it's going to be very similar to the med school exams that they give you.
Yeah.
But it's still something you're going to want to really see it before you think you're going to try and hit a home run,
Yeah. No, I agree with that. Yeah, I'm doing essentially boot camp in Anki. So that's kind of what I think I'm going to go with.
I think boot camp is probably, it's going to be boot camp, first aid, sketchies, and UWorld. And then once you get all those done, you could kind of trickle in Amboss a little bit.
Yeah.
From what Brandon Axelrod was telling me. That's like the new and improved way of studying we came up with on that podcast that we did. And I've got a lot of feedback. But, that's really kind of something to listen to after you take it for the first time.
Yeah, that makes sense. I looked up, CBSE on YouTube, and there's like very limited videos about it, which is pretty interesting to me. There's not much information out there. Like, like the DAT, obviously everyone posts videos about that, but like this oral surgery exam, it's very minimal. Like the amount of exposure that the exam itself gets for dental students. So
it's very minimal. It's very, very minimal. So that's why it's a good thing to put content out on. But so you'll be taking it this year, right? So you got it in the books, you got it scheduled, it's locked in.
Oh, I'm not taking it July this year. I'll probably start. My first attempt might be next year. Yeah.
Okay.
Because I just started studying recently, so like I don't know if it's worth,
It's worth it. I would suggest.
So?
I would suggest taking. Yeah, take that test, see what it's like, and then you're really going to be studying for it the next go around.
Yeah, that makes sense. I mean, we do have a good background here at Stony Brook about the med school aspect of it.
Mm-hmm.
Obviously, not everything. I think the pathophys, they don't go in depth to it as much as the med school does in the dental school. So I guess that's where they kind of slack a little bit in terms of just content that we learn here. But yeah, I mean, that's the plan. At least take it, be done with it latest D3 year, because I think that's a good timeline, is to finish it by D3.
That'd be ideal.
Yeah.
You're not just going to take this once and be done with it.
No,
You
no.
know,
Yeah,
it's a tough exam,
yeah. No, it's tough. It's tough. It's tough. But yeah,
and you have 6 tries to take it. That's all the tries that you need, really.
yeah,
So yeah, I think it's a good idea. It's going to be different from those dental school exams. You
yeah,
have the material, the content, the background, the foundation, essentially with the med school, but you got to see what this test is like, man.
yeah. See, it's a 200 question test, right?
Yep.
If I'm not
Yep. About
mistaken, I think.
5.5 hours. I think you have to take it.
Yeah, all vignettes, I think.
Hmm.
Just all patient and descriptions and stuff, and
Yeah.
but yeah, I mean that's fun, and I think so. This is new. I think they're developing a Stony Brook oral surgery program at the school, like by 2027. I think they said that
Interesting.
there's going to be a 4-year program here at Stony Brook.
That's pretty cool.
Yeah, because I think the Northwell, I think that the residents aren't coming to the hospital anymore at a certain point,
Mm.
so they're gonna probably want more help from the dental students in the OR coming soon. So yeah, there's a lot of changes going on at Stony and in the Stony
There's a
Brook
lot of
Hospital.
changes.
So
Yeah.
it's beneficial for us, I think, because they allow us to go in OR and shadow
Mm.
on different surgeries. So I mean, they'll need more help in there sometimes, but if they make a program here, that'd be pretty cool.
That would be pretty cool. I wonder where Dr. Pruthi would end up and those guys.
Yeah, I mean, yeah, Steinberg he's still here. Pruthi's still here. Jonky, I think he's still in the clinic.
And then you're going to get Nick Montanaro. I think Nick Montanaro
Yeah,
signed with Dr. Pruthi's practice, so
really
you guys
nice,
will get him.
nice. Yeah, so I guess he'll be here too. But yeah, I mean, right now as a D1, I'm just focused on getting my classes over with. Obviously, this first they always say D1 year is always like the most, like, just get your feet wet and make sure you get everything down first,
Yep.
and then
Yep.
D2 is much more clinical. So
It
that's
will be. Yeah.
yeah, so that's another step. But yeah, I think just the plan right now is just to finish off my classes and then keep studying for the exam.
Yeah.
Yeah, I guess taking it in July, just see what's going on, is probably is a good idea, because I think that's when you actually like
That's when you really get the idea
realize.
and motivation to study. That's why I suggest you have 6 tries to take it. It's no sweat off your back. You're only going to submit one score, but now you gain the understanding of, all right, I need to study this hard. This is exactly what I need to study. This is how I need to study it.
Mhm.
That's valuable information for when you really want to take it that second time next year.
Agreed.
So it's definitely something to consider, and I wouldn't wait too long. I don't know when about a month out they cut the portal so that you can't register for anymore. So I don't know,
Oh yeah, so it's already probably
mid-June. You should look into that. I don't know what the dates are, but definitely worth it. And then you still have oral path third year, D3 year, or is that D2 year now? Did they change
D2,
that?
because I think the D2s were complaining about it last week. So I think they have oral path the D2 year. Yeah, like end of
Oh, they
D2.
bumped it up.
Yeah.
Okay, because it
Was
was
it?
our
It was
D3 year.
the third year when you were here.
Yeah.
Oh wow.
Yeah, it was
Yeah.
D3 our time. And yeah, doing oral path, they keep just about the same amount of coursework,
Mhm.
but they add on, what was it, D3 years, like 4 days of clinic or whatever it was. It was like, now we're adding on clinic, but we have the same amount of classes to study for. So that's something
Right.
to just keep getting it all down. Get it all down. Get a nice to-do list. I like the digital to-do list. So it just, you open up your laptop, it's already there. It's on your
Yeah.
phone. It's on your iPad.
Yeah.
Do they still give you iPads at Stony Brook?
Yeah, they would do, but I think they're like reused, refurbished
Dude,
iPads.
I still use my
It's still, yeah,
iPads over here. I still use it, man.
it's 13. It's like the size of my computer, essentially.
Yeah, and they give you the keyboard thing to go with it.
Well, yeah, you gotta buy that on your own, but I didn't get one. Yeah, I just have
They gave us one, and it was really good.
Yeah.
It was what they gave us that year was really nice. It's refurbished, but I'm like, I don't need a new one, an old one. I just need it to work, and it did a good job.
Yeah, I mean those are good. Yeah, it's nice to get that kind of stuff, just to have it. Obviously, when you're studying for the CBSE and even just like med school classes, you just need an iPad and a computer, which is kind of better necessity.
Yeah, it's really
Yeah,
convenient. And then you can take the iPad to and from school. You can kind of keep the laptop at home some days as like a desktop,
exactly.
or bring it in. Yeah, it allows you to travel light when you need to. If you're going to sim lab, do you really need to bring your laptop? Just throw everything on your iPad, and then
iPad. Yeah,
you're going to be days you're only going in for sim lab or clinic, and it's like, I'm not bringing a laptop and potentially get it stolen. Yeah, you don't need that.
exactly, man.
It's good stuff. Hey, it's pretty cool that we we're doing the Dose of Dental podcast, and but it's funny because we actually met, just for listeners, we actually met before that at the New York Sports Club playing basketball.
Yeah.
This is how many years ago do you think that was?
I mean, dude, I was in middle school for sure, because I moved here when I was going in 6th grade, so it must have been 6th, 7th, 8th grade, something like that. So like
Yeah. Probably high school, maybe even high school.
I don't know, high school, yeah. So it must have been 2016. I think 2016, 2017.
Wow.
Yeah,
Oh
that was
man.
yeah. And then I saw you at one of our prenatal events in when I was in college, and I was
That's
like, oh,
right.
this guy. Remember this guy? He looks familiar. Yeah, so that's kind of how it all started,
That's
and
great.
now, now here we are. It's crazy.
Here
And
we
then
are.
you just graduated from NYU, so like you're coming to Melville, man. That's close.
Yeah, I'm gonna be right here. I'm in Smithtown right now. I'm moving back into my childhood house, and I'm gonna try and buy it for my dad and try and like simplify life a little bit because in
Mhm.
residency it gets a bit complicated. You get very little time to yourself, time to your family, and then you kind of get to reevaluate like what really matters in life and how are you going to get that like that sweet zone of balancing life and work because
Mhm.
I want to work, but I also am not really a fan of working in the middle of the night on a Saturday, and there are a lot of oral surgeons that are attendings or they graduated residency and they're doing
Mhm.
that now. And that's just not the lifestyle that I'm excited about. I want to kind of hone into. So yeah, that's the goal. Monday through Friday, Melville, and living here, keep up podcasting content. I just did a podcast with this oral surgeon who became a lawyer and now he's working for an insurance group. So we went over a malpractice case. And so that's one of the things that we're going to add to the podcast now is let's get this malpractice review. One case a month we'll go over.
Mhm.
And I think that's going to be a big dimension, for educational purposes of what you don't learn too much in dental school
Yeah,
and to learn as a dentist and stuff. So yeah, it's exciting.
super important. So out of residency, did you have different options for where you wanted to go for office? What, like private practice or something else? What were kind of your options when you came out? How'd you kind of decide what
Sure.
you wanted
Yeah.
to do?
You could go into private practice, and then in private practice, that's like an office setting oral surgery. You could work in a corporate office that's like DSOs. That's like much bigger groups. You could work in a mom and pop shop where it's like one, maybe two offices. You could go there. I found a group that it's owned by one guy. It's a private practice, but he's got 7, 8 offices coming in now potentially. He's got 7. And he's got like 7 surgeons working for him. So I'll be in one of his offices and seeing what I can bring to the table because the goal would be some kind of partnership down the road, but I'd have to prove my worth as
Yeah.
partner worthy. Not everyone's partner worthy. Why would you give them the offer? So that's kind of that. There's also, you can be an attending at a residency program. You could do like Dr. Pruthi, where he's got his own office. It's his office. And he also works as an attending at the hospital, Stony Brook Hospital, at the dental school, I guess.
Right.
He was maybe there more a little bit in the past.
Yeah.
Now he's big in between those. And could also just do research. There's some oral surgeons that they work a little bit at the school, they work with dental students, they do research, or you work with residents and do research. Best option, I would say, you could do fellowship. You could do fellowship for the training, learning in maybe head and neck oncology. You could do head and neck cancer surgery.
Right.
You could do plastic surgery. I know couple guys who they do cosmetic surgery on the face. I know a guy who's an oral surgeon, but he went to do a fellowship in Oklahoma. He does boobs and butts. He does BBLs, Brazilian butt lifts. He does tummy tucks. He does boob jobs. He does all that. So there's so many different directions you could go in oral surgery.
Right.
And you could do it in either the 4 or the 6-year track. Some may say it's beneficial if you want to do a fellowship to get that MD, just so that it kind of levels the playing field with you and other applicants. But if you were going to be applying, just my hunch is if you're applying to like a head and neck fellowship or a plastic surgery fellowship, you're probably going to be looking to develop like a relationship with the program director, the attendings there, whoever the surgeons are that are going to be training you, not just go in and put an application in with your degrees on it. So,
Yeah.
but there's several pathways you can go.
It's true. And then if you had the MD, right? Are you allowed to work in a hospital as a 4-year? Like, how does it?
Yeah.
Where's the line? I guess with that situation.
There's no line. You just have to show them your credentials, your degree, and it's like a couple papers that certify you if you're working in the hospital. I mean, I've been working in the hospital for the past 4 years.
Yeah.
These hospitals just need to understand the difference between a general dentist and an oral maxillofacial surgeon and what kind of access and privileges you have in that hospital. It's really going to come down to the hospital. If I really want to work in a hospital and figure that out. Here's another thing. They don't tell you this until you're in residency. And it's like, you want to be a board certified oral surgeon. Well, you got to take the part 1 boards that's written, part 2 boards that's oral. So you have a panel of, I guess, several attendings, oral surgeons, and then they question you on cases. What would you do here? What is this? What's your diagnosis? How do you treat it? And that's like, I think, a couple hours. They just kind of ask you questions. I don't know exactly how long it is, but once you pass those, then you're like on paper you're board certified, but the board will only certify you if you have hospital privileges somewhere nearby. To get those hospital privileges, the majority of them, they want you to take call. So we'll give you hospital privileges and rights to our hospital, but you have to take call. When you take call for them, now you're working for them. And a lot of these hospitals, at least the ones I know, they're not paying for you to take call there. So it's like do free work to get hospital privileges, but I don't know. Working in the hospital setting is very different from the clinic. And I kind of feel like that's a little bit manipulative, you know?
Yeah, you got
Once you
kind
pass
of
all the exams, and then why don't you if I'm going to take call of your hospital, if you're the board, why don't you advocate for surgeons to get paid for to do the work at the hospital? But, so that's what is going on today. Surprise, surprise. So I don't know, man. Yeah. What a call.
Yeah. And so, I mean, as your private practice that you're going to be working at, what are you expecting to start off with? I mean, like your first few days, are you just going to be looking at consults and building your repertoire?
It's an heavy insurance based practice. So if I see, and I got to work on it with the boss, Dr. Ross Chafkin, he owns the whole thing. I want to see how he does it. But if I'm good enough where a lot of people want to book with me for me, and then all of a sudden appointments are getting booked 6 months out or more, I'm going to be like, look, we got to do something here. You know, I can't just be treating everyone if there's certain people that want to come here for me. So then I'd probably take off some insurance plans and I'll be more fee for service. And then maybe that'll get it down like, oh, maybe it's 1, 2, 3 months out. But yeah, I'm trying to see as many patients as possible. But obviously, if some people are willing to pay out of pocket and pay more, why would I take the bare minimum insurance pay when, and I got to wait 6 months to see the people that want to pay to be seen now? Yeah. I gotta see how that works, because I want to see everyone, obviously, but also some of these insurance plans, they've been decreasing their rates. Realize that oral surgeons today, in some cases, are getting paid less than in like 2001.
Dang.
Yeah. And then you adjust it for, even if it's the same, if you adjust it for inflation, that's 33% less. There was an email that Omsnik sent out a month or two ago about that. Yeah, so that's not cool. We're doing the same work. Why am I making less or getting paid less? So I'm that's what I like to do social media content about, to kind of expose this. This is messed up and this is unethical to people taking care of patients. When you're an insurance provider and you just sit behind a desk all day, you don't see any patients whatsoever, and you're just paying the people less to do. So yeah, that's another reality of healthcare and dentistry and oral surgery that you'll be seeing.
Yeah, I mean, it's rough. I think that like insurance and everything I've heard about insurance and dentistry is just, I don't know what direction it's going to be heading in the next 10, 20 years. But I mean, a lot of people won't be able to get care, I feel like, with certain insurance plans. I've seen it in my office too, where I used to work, and it was just like, it was rough. And at what point, like, does a filling, like, you're spending like 40 minutes sometimes on like a certain procedure and you're not getting paid.
Yeah, and then dentists are now rushing. They're trying to get things done in 5 to 10 minutes. And because it's like that slot prep that might be reimbursed like $18 from one of the Medicaids.
Right.
You're spending 4 hours on 2 fillings and one of them is only getting reimbursed $18. This isn't going to work. So
no.
That's something to think about. Let's do this. How many students are in your class right now? Because I graduated 2021, started 2027. We had 44 in our class.
Yeah, we have 46.
46?
46, yeah.
Okay, good.
And it kept it around 45, 46. We had 47, then it became 46. But yeah, it's been around 40, 45, 46, 47.
Because when I graduated, I think they had 48 coming in around 2021. So that it's only 46, that's excellent. That's really good for you too. That will translate to more clinical attention. You're going to get more hands-on experience.
Also, I think the sim lab dictates a lot of what like the class capacity can be. They haven't extended the sim lab to have like 55, 50, 60 seats. So the sim lab is still like 40, 48 seats probably.
Something like that, yeah.
It kind of dictates what they can actually have as class size until they expand that, but I don't see them doing that.
I agree with you. Some of the metrics that they're using to expand class sizes and stuff, sometimes they don't use that. I mean, it's obvious. You can't train this class, you know what I mean? But if you take what NYU does, they divide it up into 2 or 3 groups. So imagine your sim lab, but then you're only in the sim lab in the morning, and then the afternoon group comes in. So now they're maximizing the sim lab, but they're not maximizing their students' time. And that's when dental schools figure that out, it really starts to get wild. And what they already have figured out at many dental schools is they're increasing the class size, but they're not increasing the clinic chairs or the sim lab chairs. And, that comes down to the insurance reimbursement. They're not trying to see more patients in the dental clinic. They're trying to get more students so they could charge $55,000 a year for or more.
Yeah.
And that's the moneymaker. But, that's not making better clinicians. It's not making smarter dental students. It's not helping more patients. But I don't know. What is it going to take the ADA to investigate this stuff? I don't know. I don't know what someone's got to, we got to start. That's why I'm like, we got to talk about this stuff,
I mean, the biggest thing is like after school, everyone's in there, right? So like I couldn't imagine if there was like 50 seats, 100 students, how's that going to work? Like, how does that even work? If everyone wants to go practice after class or whatever, like every seat will be filled. And I don't know how they do that at other schools. Like,
well, what do they tell you for other things at Stony Brook?
Like, what do you mean?
They tell you got to figure it out, right?
Yeah, I mean, yeah, you just got to do it. Yeah, you just got to.
They don't tell you how. They just tell you got to figure it out.
You just got to show up and see what's going on. But
yeah, I'll tell you when the exam is. You figure out how to study for it. That's literally what they do.
Yeah.
So
it's rough.
They like to pass off the responsibility and accountability.
I don't know if this is true either. At NYU, I heard they like cut the bottom whatever percent of the class after like the first year.
I don't know if they will not think twice about holding a student back to make them redo a year in dental school. I know students that they may do that. Yeah, they are
$1,000 on the drain plus if you're gonna redo a whole year.
Yeah,
it's crazy.
It is crazy. It's really crazy. So they have a like an emergency-based clinic for 2 weeks. They give the students a winter break for 2 weeks. And in those 2 weeks, a little less, the oral surgery residents have to help cover the emergency clinic. So they'll have a general dentist running it, but then an oral surgery resident kind of coupled with them to kind of do more invasive work, maybe draining an abscess or something that the general dentist wouldn't normally feel as comfortable doing. Plus, we can take out many teeth. We found out a lot quicker than some of the. So they put an oral surgery resident, chief resident in there to help with the general dentist, and the general dentist supervises, but the oral surgeon kind of does the invasive stuff, right? So they paid the oral surgeon a fixed fee, and I found out that before COVID, it was $1,000 a day. That's a lot of money, and now I'm not discounting this, but for me this year, since COVID happened, they decreased it to $750 a day. These institutions, they're finding every way to cut costs. I remember Stony Brook when I graduated there. So that was 2021, but COVID started 2020. 1 or 2 years before that, they started to cut a lot of administration and receptionists and people working in the offices behind in the front. And they would have dental students do the task work over there. They're doing that for you too, right? To be, what do they call it? Like
I mean, I'm not sure about the clinic. I haven't got too much exposure there. I haven't seen any students be on the desks, but
no, CAD cam stuff.
Oh, I mean,
working in the CAD cam lab.
Yeah, they're all us. There's no like external person there, like from that.
Exactly.
I think it's all just students, TAs.
Exactly, it's all students.
It's all student run. Same like monitors. I don't know if that's all student run. They get paid like minimum wage, but. Yeah, it's
but then you don't have to hire someone with like a master's degree. You're paying a student nickel on the. You can't do that, man. That just took away someone's job. Yeah. So that's it's interesting how these things develop, but like, what's the direction we're going to going towards?
I agree.
But hey, yeah, just stick in there. You'll be fine. I would get as many attempts at that CBSE as possible. One, to know what it is, and then the other ones, I would, if you can, maybe try calling them tomorrow. Look it up on the website.
Yeah,
that's big. And then, yeah, it's just that was the biggest thing for me. So the third year, D3 years, when they added on, like I was telling you before, they add on a lot of clinic work, a lot of patients, but they really kind of keep the amount of classes that you're taking up right now. So the biggest thing for me that helped me adapt to that point was the to-do list. I used to write everything on like a planner.
Yeah.
On paper. Yeah. So every morning it would take me 20, 30 minutes to write things out. And then I finally figured out the to-do list, the to-do app. It's by Microsoft. And I don't get like paid for like supporting this or anything. It literally changed my life going from D2 year to D3 year. Now you just click a button, everything repeats that you want to be repeated every day. So you open it up, it's already there.
Yeah.
So that goes from 30 minutes to 0, and then you just keep going. And then it allows you to kind of organize it into classes, everything that's due on a Wednesday, everything that you need to do on a Sunday before the week starts, your laundry, your groceries. And then you can really kind of maximize your routine and schedule more. It allows you to fit more patients in, more studying. So that was a big hack that worked well for me. If you get to that point, think about that.
Right.
Do you use a to-do list or anything?
I have like the stickies on my app. It's like on my computer. It's just like a little notepad. It's like it stays on your desktop, and just like you can just write out whatever you want. So just
excellent
every day. It's kind of what I use now.
That's great. It works.
Yeah.
I think the biggest thing is going into digital. I think like and even study. What do you do to study too?
Right now, I mean, usually I will do. The slides are good, but usually I'll like Anki was pretty much for any class I take, I'll have to do some sort of Anki for it.
Yeah.
So Anki, I mean, through the med school, I used Anki for pretty much everything. So we actually did use Sketchy and like all the other stuff.
Yeah.
So we, Anki for everything, all anatomy, all PhD, BMD, MFM, everything. CPR too, Anki.
Mm-hmm.
And we for intro to perio, we just had an exam the other day.
And by the way, just for listeners, CPR is cardio, pulmonary, renal. It's not like actively doing.
Yeah.
It's like, think about it.
Yeah.
Like, you don't go to Stony Brook, you might not know what the CPR course.
Exactly. Yeah. And then we had intro to perio recently. So I mean, for that class, because the exam itself is all like you have to write out everything.
Yep.
When it's class like that, I like to write all the notes handwritten on a notebook and just kind of like see it and chronologically write everything so that my brain, like, okay, this question is talking about this page, this lecture that I wrote on this page, and that page had this on it, and that just kind of helps me orient myself with the question, and then that works really well. But yeah, I think Anki's king.
Anki's good. Have you tried? And then when you do Anki questions, are you doing like question answer? Or are you doing like topic answer, or like fill in the blank? Like, what's your study strategy in order to like kind of absorb that?
Yeah, I mean, the Anki will be based off the lectures if the lectures are really good in terms of like you have to know the specific thing from the lecture. Otherwise, for CPR, it'd be like just questions because that stuff. Physio is a lot more. You have to like know this certain aspect of this certain thing. So it won't be from the slides. It'll kind of just be from question like documents they give us about like practice questions. So that kind of helps me do that.
That's excellent. You could even another idea. Hey, maybe you don't need it, but if you get to a point you do need it, plugging those slides, all of them, into ChatGPT, and then saying, "Hey, make me questions, an answer that's easy for me to copy and paste into Anki or Quizlet."
Exactly.
And then see what it spits out. You could even say, you could plug in those questions and say, using these topics, I'm a like expert general dentist, board certified and everything. Please make more questions to go more in depth on these topics in the same format. Like, try using those prompts. It'd be interesting to see what you get out of there.
Yeah, Notability too also has AI tool now, so it just takes your lecture, and then you press the AI button, and it'll essentially make like an 80 question quiz document, like quiz questions. So you can just generate quiz questions that way, and then it also has like it makes a full summary of all the notes in that lecture too.
I have Notability. That's new. That's excellent.
Yeah, I mean it's still like the quiz questions are very like you'd know which one's right and wrong because of how long the answer is.
Yeah,
but it's a good way for you to just like know the material faster than like
for sure
reading the slides and stuff. So
I agree, man. Question answer is the best way to learn.
Yeah. So I want to switch gears a little bit, actually.
Let's do it.
So in terms of oral surgery, I guess we might as well talk about it since you are one.
Sure.
So, like, what do you see as a competitive applicant? So we're talking about like externships, shadowing, score. Obviously, I think score might be the first biggest like must have. I guess CBSE score.
Coming from Stony Brook, it is, because being unranked, getting ABCs, that's going to be they don't even do they even see your internal I don't even think they see your internal GPA. So your CBSE is going to be the biggest. And they know students come from Stony Brook generally. Some programs don't. Most of them do. They consider it a good school. So it's going to be CBSE for you. Letters of recommendation, externships. You got to get as many externships as you can. If it comes down to it, like clinic requirements or externships, do the externship. You're going to get the clinic requirements in. That's not going to be a problem, but you might not have the opportunity to do an externship like that again.
Right. Yeah, exactly. And I mean, so I've been to OR, and I was only there once in November, but it's like I was there for 12 hours. We did 2 bilateral TMJ surgeries. So I did one in the morning, did one in the nighttime, and like it's just a different like environment. Like it's crazy. I got out of there and like I was just in my car after that. And I was like, dude, where am I at? This is crazy. Like Ruthie just goes in there and he's just like does it every day, and it's just like it's like a different. You don't worry about anything else, just what's going on at the table, the patient, the nurse is in there, the anesthesiologist is in there. It's just like the lights are so like ominous and like ambient. So it's like it was just awesome. It was an awesome experience, and
it's a big day.
Was able to assist in there. The second surgery let me do a lot of suctioning and like hold the patient, retract a lot. That was awesome. And then there was like a point where the blood just like splattered on Dr. Pruthi's face and his mask, he was, yo, nurse, take a picture. And then they took a picture, and it was just like, it was a good time. It was just like relaxing.
He's also great because he breaks it down into a really fun and enjoyable
Yeah.
way. You know, you could be with an attending in there where they're super strict and they're getting pissed off and they're screaming, they're yelling, they're cursing. Like that could be the other thing. That's not really a good time. You know, they could be yelling at you and you're like, I remember one time Dr. Lamb was taking out a pleomorphic adenoma out of the cheek, right? And they were going to send it for biopsy, do the whole thing. They assumed it was pleomorphic adenoma. They were taking it out, and I was like kind of looking over his shoulder, and I'm fully scrubbed in, right? And I'm trying to not touch him because he's doing the surgery. But then there was like some box or something behind me, and I don't even know if I hit it or not. But he just turns around, and I don't even know how he sees anything. Turns around, and he goes, your back just bumped into, whatever the thing was. And he's like, you're no longer sterile. You need to re-scrub back in. And I'm like, okay, yes, sir. Whatever you know. And I'm looking around like, I'm behind him. He can't see a thing. And I don't even know if I hit it. How does he know? But he would, I don't know.
It's his OR, man. He knows more than that. He knows better than everybody, I guess.
Yeah. He also, there were some stories too. Yeah. That's how it goes.
You gotta say yes and move on, I guess.
Yeah.
Oh, yeah, there was he asked me a question about like a temporal nerve or something. So I was like, my hands were here obviously because I was scrubbed in, but I wasn't touching anything. Prove it, yeah.
Yeah.
There. And he was like asking me a question. I was like, maybe this, and then he was like, you gotta scrub back in, like you gotta change your gloves and stuff. I was like, oh shoot, because you can't touch. I don't even know if I touched it, but like my hands went up, and I guess he thought I did. So I was like, all right, and then we just
Gotcha.
It was chill. Like I just scrubbed back in, and the gloves, they just go in so nicely, and it was fine. It was fine. Nurse was like a little annoyed, but it was okay, whatever.
Yeah, that's all right. That's okay.
Yeah, no, it was actually funny because when I went in there, our anatomy final was like, it was a Friday. The anatomy final was on the Monday. So he was like quizzing me about the surgery we were doing and all the arteries and stuff that were, and the metapterygoid muscle, like where, like what am I touching right now, stuff like that. So it was just good timing, I guess.
Yeah,
I knew all the answers, but it was just like, that's when it was like, damn, this stuff actually really applies, because when you look at a cadaver, right, it's pretty much the same thing, but now there's like blood, like there's stuff occluding your view and you can't see certain things, and it's like, damn. So to be able to recognize these structures even when the patient's like bleeding and stuff's in the way is very important. So that was probably the coolest part for me, at least in there. I don't know if do you have any stories when you were in undergrad?
I just realized I'm going to flip the view because there we go. I mean, I don't think it goes on your screen, but if you're looking one way, I should probably be looking the other way just for the photo at the end. Well, I'm sorry. What did you ask? What was the question?
So when you were in undergrad at Stony, did you get a chance to shadow in the OR when you were there?
I actually, in undergrad, I wasn't at Stony.
Oh, wait, no, sorry, not undergrad, dental school.
I graduated from Stevens Institute of Technology in Hoboken, New Jersey. And no, there was no combined med school or dental school or 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 hospital there. NYU Poly, I went to for 2 years, but that was combined with main campus NYU, and that was on a different borough. The engineering school is in Brooklyn.
Right.
But no, I didn't get any. Oh, I did. I got one OR experience. I knew an endovascular. I knew a vascular surgeon at NYU, so I did get to go into his OR and see that and see some stuff one time. Yeah, but that was it. I didn't get to see any dentistry in the OR, any oral surgery in the OR.
How about in dental school itself, like at Stony Brook?
Yeah, Dr. Pruthi, Dr. Casino, Dr. Willoughby did not. Dr. Willoughby was clinic only. Yeah, Casino, Pruthi, and Dr. Lamb.
Cool. I mean, so what was the most what was the coolest thing you saw in there?
The coolest thing I saw, actually, we did do a TMJ case where it wasn't a replacement or anything. It was actually Dr. Pruthi took part of the temporalis muscle and then flipped it around and put it where the disc used to be. It was a complete, I don't know what the Wilt score of the TMJ was at this point, but it didn't have a disc anymore. So he took part, I forget if it was the anterior portion or the posterior portion, but took off part of the temporalis and then flipped it down and then used like the tendinous area to basically remodel the or I guess reform a new disc, that was an interesting. He does a lot of TMJ stuff that's very impressive. The coolest one I saw though was definitely actually Montefiore did a good one where it was a anterior palatal. He had a kid with a cleft palate. They did a tongue flap to repair that part of the roof. That was the anterior palate. And then in VCU, there was a posterior palatal defect and they repaired it with a temporalis flap. So actually they went in, they did a coronal incision from the top of your ear over your head to the top of the ear, flip all that down. They took a piece out. What incision did Pruthi do for TMJ? He's doing a preauricular incision right in front of here.
Yeah, like right down there.
Yeah. So,
But he'll do the one, like he'll do incision here, incision here, I think, and so he
oh,
can like
cool.
look through it, I guess, when he's
The
placing.
scope.
Yeah, when he's placing the like the is titanium, like a titanium plate?
I don't know. Did he completely replace the whole joint, or
Yeah, he did
yeah? Then he's
both
probably
joints.
doing a completely new
Yeah,
titanium made joint. Yeah,
yeah.
custom made
I
joint.
don't remember. I don't remember the whole thing being flapped open. I think it was just two incisions here, so that
It's
you
pretty
could
nice.
see it. Yeah. So I guess that reduces scar. I mean, after I would assume.
Yeah,
So
definitely
yeah,
less invasive
that
that
was
way.
cool. Yeah,
Absolutely, that's excellent.
it's cool. That was cool. Yeah, yeah, man. It was
Yeah,
awesome.
man, that's good stuff. So you're getting exposure to it. A big thing for you also to consider is journal club. That's how you kind of get to meet. You get to present maybe a little bit, get to learn a little bit from the residents. You get to hear the residents kind of being critiqued by the faculty members. That's a big thing. And then to put journal club on your application to
Yeah,
oral surgery. But the biggest thing I think you're going to get from that will be creating a relationship, some rapport with the attendings that ultimately end up writing your letters of recommendation.
yeah. I think right now Dr. Casino actually he's I think he's in Florida or something.
Yeah.
Yeah, he zooms in, and we like present every Tuesday morning at like 7 a.m.
Yeah.
So people,
Excellent.
I need to get in there. Haven't done one yet, but
But the thing is, it's good to be. You got to be consistent at those because if you
yeah,
do a couple now and then you disappear because you're studying for the CBSE,
yeah,
it's fine, but it's not as great as it could be if you could get that CBSE out of the way. Go all in on it now. Go all in on it next year, and then say you finish it by D3 year, which is your goal, right? You really need to hit these points. You got to see that. You got to get that exam in now, and really go hard on it.
yeah,
So you do finish by the time you do D3 year. You have all D3 and all D3 year to be a journal club.
yeah,
It's excellent.
yeah,
So that's what you need to be doing because remember, end of D3 year is when you'd be applying. You're going to
yeah.
miss out on Journal Club D4 year. You'll be going, of course, but the application submitted by
Coming.
August, September, right, of D4 year.
Yeah,
So you have to think you want to get most of Journal Club in your whole D3 year for
yeah,
that consistency. Yeah,
yeah, man. I mean, the CBSE is just the biggest like
it
to
is.
the AT, right? It's just a roadblock. So once you get past that, you're
Exactly.
fine then. Yeah. So we actually have a D2 right now. He finished it D1 July, or right after D1 ended in July. He was like done with it, which is he's probably been studying since like he got in dental school for that to happen. But he knew what he wanted to do right off the bat, so that's good for him, and he did a good job.
Good. That's good for him. I hope
Yeah.
he's can highly liked among his classmates. He's a team player. That's always important. A lot of the people that I saw gunning weren't
Mhm.
so collaborative,
I
but
mean, it's
maybe he
crazy, man,
is.
because you got 45 other people that are going to be dentists, and you need to have a good rapport with everybody, right? You can't
Best you
hate
can.
anyone. You got to just help everyone you can. Just have a good relationship with everybody.
That's
It's
the way
kind of
I.
hard to comprehend that because it's school, right? But now it's like everyone's going to have a DDS after this is over, and you need to know and have a good relationship with everybody in case
Right.
they refer you. Referrals are huge from general to oral surgery, or from any specialty really. And these guys, anyone can do anything. So
That's right.
you just have to have 45 friends.
As best you
45
can.
friends.
As
Yeah,
best you can.
as best you can. Yeah, you don't want to.
Some people are going to bump heads and this and that, but you really want to try and get along with them because it's advantageous to study for things or practice in the sim lab. Even it's as little as, hey, you going to the sim lab tonight? I'm going to try and be in there till 8 o'clock. You want to go? Let's go. Let's go do it. Let's go do it.
Yeah,
And even if you don't teach or do anything, at least you can kind of hold yourself accountable. Because God, I mean, you'll see sometimes being in that sim lab a couple years when you're doing your dentures, you're setting teeth until midnight. It's nice to not be in there alone.
yeah.
So something to consider.
I wish we had a window in there, man. Window.
No, no window, no
A
nothing.
window, just no. I don't know if it's legal, honestly. Crazy, but that's life. It's all we signed up for. So
Yeah,
whatever,
yeah. Good
whatever.
stuff, man. I'm glad we got to touch base. I want to know how you're doing.
Yeah, man. Anything else you want to cover briefly?
No, this was great, and we talked a lot about Stony Brook. People that are looking to apply, maybe they're considering Stony Brook as a dental school. I think we touched on a lot of things from there.
Yeah, the new class is coming in. We met them last week, and the craziest thing I think I noticed was that there's a lot less like Stony or Binghamton kids coming in. I think most of
Hmm.
them are a lot of private schools. I think a lot of places around the country compared to our class. So I'm interested to see how Stony Brook how their application, how their admissions is going
Huh.
to change in terms of like in-state kids and out-of-state kids. Like it's going to be
Yeah.
interesting to see and what schools they pull from now. But yeah,
You think they're taking more out of state? Is that what
I
you
think
saw?
I think that's the consensus. They've been taking more out of
You
state
said a
now.
lot of private schools.
A lot of private schools, a lot of IVs. I think we had a lot of IVs coming in.
Hmm. That's
Um,
always good for the school's reputation, but I'm always curious if
yeah,
like are they taking students that can afford it more, but is that compromising merit of people who are applying, or is everyone getting a fair chance? I don't know. I always like to look into
It's a
these
tricky
things.
discussion because you don't want to. It's a tricky discussion to assume.
Yeah,
Maybe
yeah.
just more.
Oh, you can't assume. You can't assume.
Yeah.
But generally people come from Ivy Leagues. I know a lot of people that came from Ivy Leagues do great in DAT, so it could be
Yeah.
good scores. And
Yeah.
Stony Brook sometimes they take a lot of Ivies and very high merit schools here from certain years.
Yeah.
Yeah,
That's it,
excellent.
man. When do you start up work? Next week?
Mid-August, I got plenty of
Oh,
time.
so later, right. You go travel and stuff until then.
Yeah, man. Yeah, I got to get some
You're in
traveling
Smithtown,
in.
man. I'm also in Smithtown. I mean,
What
yeah.
part? Where are you in Smithtown?
Right in Wisconsin Library, right behind there, the Armory.
Oh man, you're in. Oh yeah, near the
I'm
army.
in Wisconsin, but it's like right next to Smithtown. Like if I drive out, I'm in Smithtown. But
You're south of 347. Is that right?
yeah,
Yeah, right. You're south of
yeah,
347.
yeah.
Yeah. Okay, I'm north. I'm near like Uncle Giuseppe's.
Oh, okay, it's still super close. Yeah,
Yeah, yeah. Hey, it's a nice area. It's a big town. There's a lot of stuff going on. We got the malls over there.
yeah. It's good. It's fun.
Where do you work out? Because I got to look at places for a gym membership.
I go to Crunch right now in Lake Grove. There's
Crunch.
one in Hop Hog too, but Crunch Lake Grove.
Yeah, my girlfriend goes to the one in Hot Pod. Crunch Lake Grove is near the mall, right?
Yeah. Like near LA Fitness. Yeah, it's like down the
Yeah.
road more. Yeah,
Right. There's an LA
it's by
Fitness.
Wegmans now. They have a Wegmans opened up. Right, it's in the same complex.
Nice.
Yeah. Yeah.
Not Uncle Giuseppe's parking lot, but there's one right next door where there's an LA Fitness over here.
Mm.
That's really close, but I don't know. I don't know. I got to see what it's like. You know what I mean? You got to find a place with all your stuff.
No basketball court there though. LA Fitness has a basketball courts.
Oh, yeah.
Yeah.
God, don't you wish the New York Sports Club? Don't you wish that was still around?
Yeah. I mean, I still go to the rec here sometimes at the Stony Brook rec.
Oh, yeah.
It's a great, insanely nice court. So we still play there a couple times. So
It's huge. They got like 3 courts in there, no?
Yeah, 3 full size. Yeah, 3 courts. Yeah, it's great. I love it.
I did the intramural league 1 or 2 years there during dental school. That's a nice facility.
Yeah, I think we're gonna have we're gonna have a team next year too.
Oh, there you go.
Yeah,
There you go.
hop on, bro. You still got it.
I think it's just gonna be golf for me here on the way out.
Probably safe to bet.
Basketball, you're just, God forbid, but like if you earn that rec league and you even just jam a finger, don't even break it, it's gonna heal, it'll be fine. But if you're trying to do like work on a practical and it's your dominant hand,
Yeah, you're screwed,
dude. You're like just be careful,
Yeah, we can talk about this another time, but like I think just being in dental school, like you realize how important your hands
Hands and eyes,
everything matters so much.
and your back.
Huge back abs.
Those are 1, 2, and 3 things. Just be careful. Work on your ergonomics, your posture when you're working on those things. You'll be all right.
Yeah, man, it'll be fun. So whenever you get comfortable in your practice, I'm gonna come shadow you.
Come on in, man. Yeah.
Yeah.
Let's touch base in like September time. But dude, I really want you to focus on CBSE right now. I want you to crush that.
That's the biggest thing.
If you crush that coming from Stony Brook, you're going to be just fine.
Yeah. I mean, I'm looking at the boot camp schedule, and it's a lot of stuff that we've already covered in the med school. So when I get to that part, hopefully it'll just kind of be like, okay, this is what I remember this now. So
yeah, that'll be good.
But yeah, man, it's just a grind. It is what it is.
There's always something else.
It's a fun grind. It's a fun 8 to 5, 9 to 5, whatever. It is what it is, man.
All right, man. Good talk. This is good. This is great that we should do this more often.
Dude, yeah, we should do one like every month. We just choose a topic and just kind of hop on and just catch up, whatever.
Let me know. And anything I could help you with. Well, I mean, the CBSE sounds like you got a good thing. You need to see this exam first. Keep studying. You'll be all right. You'll be all right.
Yeah, definitely. Yeah, man, I'll hit you up whenever I need.
All right, man. All right. Be careful on that basketball court, but we'll touch base soon.
Yes, sir. Will do.
All right, brother. Keep going after it.
Yes, sir. Appreciate you.